There is not a single biochemical pathway which requires ingested carbohydrate. I say it over and over again. We do not need a carbohydrate in our diet. Everywhere where the blood glucose is elevated, you're toasting your tissue. So you're toasting your kidneys, you're toasting your brain, you're toasting your eyes. Every single corner of the body. And that's just one aspect of the glucose metabolism. The crunch time for me was when I had a guy in his 40s that I was considering amputating both of his lower limbs. I ended up amputating one of them. And he was sitting there in hospital eating ice cream. The pathology within his limb didn't happen on that last week. It had built up over decades. If you have more than 4 grams of carbohydrate at one hit, it's going to affect the lining of every blood vessel. It damages that. If it goes above 4 grams, you'll produce insulin. Insulin also is an inflammatory hormone. It's also a growth hormone which stimulates cancer. We're not talking about very much. And this might seem somewhat extreme. I'm talking about a bite of an apple.
Another question that people ask is, well, what do I eat? Everything seems bad.
Okay, I'll summarise it in one sentence. I often say, if you want to eat by the food pyramid, you're going to die by the food pyramid. We've screwed ourselves over.
If you think you're eating healthy, you might be surprised by what you hear from my guest today, Dr. Gary FETTKE. There are some foods that I bet you're eating every single day, which is slowly causing disease. Now, this information is not what you're going to hear from the mainstream. You won't hear this from big food or big pharma, but it's advice that could potentially save your life. And now for the episode with Dr. Gary FETTKE. Dr. FETTKE, welcome.
Good morning or good afternoon, evening, wherever you are.
Now, you are an orthopedic surgeon for the last 30 years, and you've seen so many patients at the end stage of their chronic disease who need their legs or their arms amputated or cut off. And over 90% of the reason for this is because of the foods that we are eating.
Now, the crunch time for me was when I had a guy in his 40s that I was considering amputating both of his lower limbs. I ended up amputating one of them, and he's in hospital and trying to control out of control infection in both of his feet and legs. And he was sitting there in hospital eating ice cream. And I said, "Why are you eating ice cream?" He said, they told me I can have it. I then started looking at the hospital food guidelines, which said it's okay if you've got type 2 diabetes and it's out of control, that you can still be given ice cream 3 times a day with morning and afternoon tea and supper snacks, including biscuits, cakes, cookies. A totally ridiculous diet with no nutritional benefit, yet that was actually the national food guidelines, and it still is. And I've presented the national food bodies about that. And they say, no, it's not. And I say, look, here is your document. I started challenging the hospital food, going, this is ridiculous. But I then started studying nutrition, which is something we're not taught in medicine. And so I started studying, in particular, the role of sugar. But effectively, I challenged the hospital food system and particularly the sugar content. I then went on this thing called social media, and within 48 hours was targeted by someone who was working for Coca-Cola at the time. And over time, I was then targeted by people who was working for I was targeted by the breakfast cereal industry, and we've got all this documentation to prove that. Then I was reported to the medical board for inappropriately giving nutritional advice outside of my scope of practice, even though we're talking about preventative health. I'm advising my patients, stop eating sugar, particularly if you've got diabetes, and stop eating ultra-processed food, particularly if you've got inflammation. And so I got reported to the medical board, and by a dietitian at the hospital, and we take the trail back, we've got the emails and the receipts from the food industry, the breakfast cereal industry, to the Dietitians Association here in Australia, the CEO of the hospital, of the Dietitians Association, demanding that the CEO of my hospital silence me. I wrote back to them pretty well saying, that's a joke. But they took it seriously. As it turned out, I got reported another 2 times over the next 2 years, one of which was for inappropriately reversing someone's type 2 diabetes on national TV. So it was inappropriate to put someone's type 2 diabetes into remission. So ultimately, I was exonerated on all charges and actually received an apology in writing, not a public one, and we were able to get them to retract the media statements they'd made about me, which is, again, this is all political. It had nothing to do about patient care. It had nothing to do about biochemistry. It had nothing to do about science. And that's the tragedy that we've all been growing up in, evolved in. The information we're receiving, it's actually not science. It's politics, it's money, it's ideology. It's fascinating how much we've been screwed over. And when you start realizing that this is a slow, insidious torture of your body, and the processed food that we've had, well, arguably since the agricultural revolution. So you can trace our inflammatory joint disease, we can trace back modern disease back to the agricultural revolution. You can go to pre-agricultural revolution skeletons, and in Spain they will identify, oh, that's pre-agricultural revolution, that's post-agricultural revolution, literally in the changes in their bone. 10,000 years we've been processing carbohydrates into our diet, milling grains, storing grains. But in the last 40 or 50 years, we have exponentially increased our inflammatory component to disease. Ultra-processed foods now have been giving us low-grade inflammation right through the body. So in the person with diabetes, we can talk a bit about fructose metabolism, glucose metabolism, inflammatory seed oils in that process, but he has had a slow, chronic inflammation in every blood vessel, in every cell, in every mitochondrial membrane for as long as he's been eating processed food. And the culmination of that over time is that you end up with microvascular disease, narrowing of every blood vessel. You've got chronic inflammation in the tissues, a fibrosis in the tissues. So they have poor circulation, poor local immunity, and all you need is a little tiny scratch or break in the skin, dry skin, some bacteria get in there, fungal infections get in there, and then the body doesn't have the ability to fight that. And so over a long, long period of time, a war between the local infection and the body's immune system trying to control it. The only way to get rid of that isn't with dressings and antibiotics. It's to chop the bit of dead tissue off, because no good circulation is going to get in. So you've got to get back to an area where there's reasonable circulation. They recognised that amongst all of my colleagues, I got to clean all that up. So therefore, all the horrible deep infections, it's not just diabetic foot problems. I did most of probably most of the deep joint infections. So someone has a hip replacement or a knee replacement, same problem in our society now, poor immunity, deep infections in joint replacements, months in hospital, same problem. If you've got a person who's chronically inflamed and they've got diabetes, they're in deep strife. They're not going to fight that. Do we keep chopping limbs off? To the end of my surgical career in the public system was every week there'd be 20 to 30 patients in that clinic with gangrenous toes, gangrenous feet, and you'd be doing this slow but sure, chop a bit of the toe off, chop another toe off, then chop off the forefoot, then the midfoot, then the ankle, and then the below knee amputation. And if you end up with a below knee amputation, mortality, your 2-year mortality is around 50%. So 50% of people die within 2 years of having leg amputation. If you go past a bakery, you'll see all those breads and pastries and cookies and whatever, which are all brown. They've all tanned. That brown is actually called cooking terms, the Maillard reaction, Maillard. So look it up. And what it is, it's a caramelization. And what happens actually under the effect of heat, you get a combination of the glucose, which is half of sugar. It's glucose combining with the protein, and it browns, it caramelizes. Now, if you've got diabetes and your blood glucose goes up, some of that glucose goes into the tissues, about 2/3 of it. So if you elevated blood glucose, and I think glucose is terrible thing, and the body does everything in its capacity to get rid of it. So, which is a different sort of slant on it. Anyway, the blood glucose goes up, the tissue glucose goes up, and under the effect of body heat, there is a glycation of protein. So the glucose combines with the protein, and under that small amount of body heat, it combines and caramelizes. So it's literally toasting your tissue. So everywhere where the blood glucose is elevated, you're toasting your tissue. So you're toasting your kidneys, you're toasting your brain, you're toasting your eyes, you're toasting your toes, every single corner of the body. And that's just one aspect of the glucose metabolism. So therefore, how does that fit into the brain? Well, every time your blood glucose goes up, that's going into your brain and you're slowly toasting your brain. And so type 3 diabetes is sometimes called dementia. And dementia and Alzheimer's are all loosely connected, but one of the major components of it isn't just, it's not just glucose, it's not just diabetes, but it's a major player. And so as we move forward in life, what you want to do is you want to knock down the major components creating inflammation in the body. And one of the major components is ultra-processed food. And you're going to reduce your risk of dementia. You're going to reduce your risk of brain damage. But you will reduce it in yourself. There may be some improvement and recovery. But one of the arguments I use is you're going to improve the health of your children because you're setting the example. And whoever the elders are in the family, they're generally saying, okay, this is what the family's going to eat. And a lot of people say, oh, my health problems are generational and it's genetics. And I say, no, that's nonsense because it's the way you're eating what your parents ate and what your grandparents ate. And so for the last couple of generations, we've been having this massive exposure to ultra-processed food. If all of the science behind that, that was my COVID talk, which is on YouTube, carbohydrate, the dose is the poison. Because if we're demonizing carbs, I went through the academic argument trying to work out actually what is the dose? Because the dose is the poison. That's an age-old adage. So it's the dose. So I came up with the argument that 4 grams of glucose, above 4 grams of glucose, above 1 teaspoon of glucose, above 1/5 of a slice of bread, starts to have a negative effect on the system. One of those effects is that when the blood glucose goes up, the tissue glucose goes up and you get the Maillard reaction. But there's other effects that it does the same thing with when we give ourselves a glucose load. So one slice of bread is not going to give you dementia, but one spike of your blood glucose every day for the rest of your life might. So 4 grams is a small amount. It's about 1/5 of a slice of bread. A standard bowl of pasta, it's 1/20th of a standard bowl of pasta. We're not talking about very much. We're talking about, and this might seem somewhat extreme, I'm talking about a bite of an apple. So an apple's got about the same sugar content as Coca-Cola. And people say, oh, one's natural sugar and the other one's not natural sugar. No, they're both 10% sugar, both fructose and glucose. They're both 10% sugar. It doesn't matter which one it is. A banana's got more sugar in it than Coca-Cola. That's 16 to 24%, depending on how ripe it is. If we're looking at it purely from a biochemical aspect, if you have more than 4 grams of carbohydrate at one hit, it's going to affect the blood lining of the lining of every blood vessel, which is called the glycocalyx. It damages that, but it repairs itself. It will, if it spikes above normal levels, it will go into the tissues and it will create the Maillard reaction. If it goes above 4 grams, you'll produce insulin. A small amount of insulin will turn that glucose, that carbohydrate, into fat. That's fine, but over a long period of time, pushing that excess carbohydrate into fat makes us fatter. Insulin also is an inflammatory hormone. It's also a growth hormone which stimulates cancer. So a low-grade chronic inflammatory dose of insulin over a long period of time is a growth hormone for cancer. That's why people with diabetes have got higher rates of cancer. It's part of the insulin-resistant state. So a small, 100 grams of glucose, fine, but don't do it all the time because your body over a long period of time is actually not meant to have that. Our bodies are meant to actually eat sugar in season to get fat for winter hibernation. And at that time, when we eat sugar in season to get fat for winter hibernation, it drives behavior towards eating more and storage of fat. And then we burn that off in our hibernation fasting period. That's what happens in the animal kingdom. The benefits of fruit are clearly overstated, both by the corporate world and by nature. So there's a talk of mine, is fruit good or bad for you, which stemmed out of a debate with a professor of nutrition. If you're an animal, fruit will drive behavior. So you'll see the fruit, which is advertised in nature by being bright and shiny and sweet. It will then drive you to eat it because A, you're attracted to it. You'll go and find it. You'll eat it. Animals will do this in the wild all the time. They'll eat it one day before you want to eat it as a human because they just wait for the sugar level to go up. They will gorge themselves on it. It will turn into fat for that winter hibernation, and they'll lie around in a lethargic phase. I don't know if you've ever seen those pictures of monkeys that are actually gorging themselves on fruit, and then they're lying around in a drunken stupor. Guess what fructose does in the liver? Fructose gets converted down the aldehyde pathway into alcohol. Over a long period of time, if you drink too much alcohol, you'll get non-alcoholic fatty liver disease, one of the causes of non-alcoholic fatty liver disease. If you eat too much sugar over a period of time, you'll get non-alcoholic fatty liver disease. And a part of this, I think, is actually what is related to children's motivation. We've got generations of kids who are not wanting to go out and do stuff, but food is part of that. And if you actually sat down with your 5-year-old and your 7-year-old and gave them a glass of beer or wine every day, you wouldn't expect good health outcomes. Well, that's what sugar does in the liver. That's just one of the pathways of sugar, of fructose in the liver. Down the aldehyde pathway is into alcohol production. And so one of my slides has got, put fructose in and you get a glass of red wine out the side. Again, I'm simplifying complex biochemistry, but that's what it does. The other thing that fruit does, or what fructose does, it actually stimulates ghrelin. So ghrelin's a hormone which is produced by the stomach to give you the tummy rumbling, and it makes you feel hungry. Well, fructose stimulates that. Fructose also inhibits leptin. So leptin's a hormone secreted from our fat. So if you've got plenty of fat on board, plenty of storage, the leptin is secreted and it tells your brain, stop eating. Fructose comes in when you eat it, tells you, and inhibits that pathway. So you're losing these pathways of inhibition, or you're gaining the pathway of stimulation to make you hungry, which makes sense if you're a possum or if you're a squirrel or something trying to get hold of an enormous amount of sugar and carbohydrate so you can get fat for winter. So literally you can overeat. And again, we see that in society. You put sugar on the table, but literally that food is laced with sugar so that you will eat more. You will also get a bit thirsty because sugar and carbohydrates in combination, you need more insulin to produce that. Insulin means you store more water, so you get more thirsty. So it's a perfect thing to put in food in restaurants. It's a perfect food to put in food by the processed food industry because it will drive behaviour for you to eat more. It's like if you open up a packet of chocolate biscuits, it's really hard to eat one. In nature, it's really hard to eat one cherry. If I give you a bowl of cherries, who can eat one? Would I eat an apple a day? No, I think it's 10% sugar. I think the fibre content of fruit is overrated because you don't actually need fibre in your diet. That's another controversial comment. But fibre in our diet is not the primary benefit of a good diet. I think we have a good gut microbiome from a variety of foods in our gut, and it's not dependent on the fibre. We're told that it is, because that's a marketing term by the cereal industry to actually get us to eat more fibre. The vitamin C, we actually don't, there's very little vitamin C in an apple. And in fact, if you don't eat carbohydrate, you don't actually need much vitamin C in the metabolism of it. That's another pathway of fructose. I can keep coming back to that, but fructose gets converted to uric acid in the liver. One of the breakdown products is uric acid. Uric acid is the thing which most people hear about with gout. But there's increasing gout in society, but people are having less alcohol and less red meat in society than 20, 30 years ago. But we've had a doubling of gout. And it's related to fructose. So fructose gets converted to uric acid. Uric acid can push up your blood pressure, but it does that by a pathway called related to nitric oxide. So nitric oxide, and I know some of you guests have been talking about that in the past, but nitric oxide has a major, major benefit. In fact, without nitric oxide, we're dead. Nitric oxide keeps our blood vessels open. It keeps our blood flow going to our brains. And it's central part in the immune system and how white cells move around into the tissues with infection or with just controlling dead tissue. We need nitric oxide. Nitric oxide production is inhibited by uric acid. The antidote for that is vitamin C. So Mother Nature, in her wisdom, has, if we're going to eat fruit in season and we're going to gorge ourselves on it for that short period of time, then the fructose is going to get converted into uric acid, but she's going to provide a little bit of an antidote in vitamin C at the same time. Do that over a long period of time, and then it's a waxing and waning uric acid, nitric oxide, fructose, alcohol production, inflammation. It's all waxing and waning. But the fascinating thing, but if you don't eat the carbohydrate, you don't actually have that converted into fructose. You don't need the vitamin C. So the Arctic explorers in history, the Inuit Eskimos, the early explorers that came around the world, did not need vitamin C. It was the European sailors that were having their grains and their gruel and then got scurvy that needed the antidote of limes and citrus fruits to give, so they could explore greater nations. But it's really, so I actually think that, the early European explorers, they struggled because of scurvy. But if they had have just been eating meat and fish on the boats, they might not have had the scurvy, because the more northern European explorers didn't have the scurvy. If you're going to eat some fruit, understand that it's going to drive behaviour. Fruit for breakfast, you're going to be hungry within 2 hours. Anybody who eats fruit, 2 hours later, they're still hungry. You didn't mention berries in that list there. One of the things that people talk about berries is all the benefits of antioxidants. And you can have frozen berries, and what's interesting, after 2 to 3 months of freezing your berries, those micronutrients, the phytonutrients, the antioxidant behaviour of them is completely gone. So if people have frozen berries in their freezer thinking, I'll have that out of season, then they're just little pebbles of sugar. So don't kid yourself, because again, that's marketing, but they don't tell you that if you freeze this product, it's going to lose its. Modern fruit has been bastardized. It's been modified, and doesn't have to be genetically modified, over time to be bigger, sweeter, lower fiber amounts, because fiber will make something rot and go rotten a lot quicker. Sugar, the increase in the sugar and content of it improves the shelf life. And we can look at that from a cake aspect. A piece of bread got some fiber in it, and it will go moldy in a certain time frame. If you put more sugar in that bread, it will last longer. And if you put more sugar and make it into cake, it will last longer. And so the classic is a fruit cake, or in your wedding day, you'll have a fruit cake with lots of icing on it. And you can come back and eat that in 20 years' time, because the icing and the fruit has literally been a preservative. So by adding the sugar and decreasing the fiber, you've improved the shelf life and the transportability and the profitability of fruit. So our modern day fruit, our mangoes, are now twice the size they used to be. They've increased the sugar content by 50% in comparison with 20 years ago. They've decreased the fiber content by 20 or 30%. The soil, which is actually nutritionally depleted now. So our fruit of 2024 has less micronutrients in it than our fruit of 100 years ago. It's got more chemicals in it. Our fertilizing ability means that we bind the magnesium in it. If you put potassium into the fertilizer, it binds the magnesium in the soil. So virtually all of our food, not just fruit, is actually magnesium depleted now. So even your animal-based product has a reduced magnesium in comparison with 50 to 100 years ago. Honey, again, I talk about honey in nature, difficult to find, and if you do want to do it, get hold of it. You've got to raid a beehive. The honey is being stored by the bees for their winter hibernation. So if you want to rape and pillage someone's house of all their worldly goods, understand you're doing that to a beehive. Honey is high. It's about 55% fructose, 45% glucose, whereas sugar is 50% fructose, 50% glucose on the whole. And because it's a bit sweeter, it drives behavior. Ancient Egyptians, you can still get, they've opened up some of those tombs to actually find honey that's still there. Again, because it's preserved for hundreds and hundreds of years because of its sugar content. Again, honey in small amounts, fine, but understand that honey in your glass jar in your pantry is not natural. A method of production which has been around for hundreds of years, not thousands of years, but only a few hundred years. The other side is that we need bees to be pollinating our trees and our fruits and our grains and our lands and our grasses so our animals can eat it. And we've interfered in their ecology so much. This is the environmental aspect of our food production. We've actually got, in the US, they have bee colonies which they transport from the east to the west coast and vice versa, with a massive loss of beehives just to pollinate the fruit trees and the crops. Our pesticides are clearly playing a role in bee populations. And our future is looking pretty bleak if our bee populations reduce. I used to be addicted to all this stuff. I'd have my fruit for breakfast, fruit for snacks. I'd have honey cornflakes, honey toasted cornflakes. And I used to have honey, just a spoonful of it. I was completely addicted. I'm sorry, I was wrong. I was wrong to myself. It's not needed. It was driving behavior. It was making me hungry. And it was contributing to my weight and health issues. There's over 100 different names, and you've just, mentioned agave syrup, and if it's got agave syrup or it's got honey or it's different. And they're just the names of the natural sugar. It's literally just marketing to confuse us. When you look at it, I can look at it and go, oh, that's a sugar, that's a sugar, that's a sugar, that's a sugar. And they may list 5 different sugars on there by different names, but they don't have to sort of group them together as sugar. You can get a guess, though, however, if you read the percentages. In Australia, we're actually better at having our labellings better than in the US, because it will tell you the percentage of carbohydrate and it'll tell you the percentage of sugars. When in the US, it doesn't have to do that. It'll mention what the ingredients are, but not the percentages. So we're a little bit better off, but most people don't read labels. There are 2 ways to look at that. One is, I'll argue, if it's got a label on it telling you what's in it, don't eat it. Number 1. Number 2, if it's got 5 things on it, definitely don't eat it. And this comes from Karen Zinn, who's a dietitian in New Zealand. Now, we have an empty pantry, full fridge, but that means shopping regularly. It means actually having to prepare food. And the expensive way, people say, oh, it's expensive to be low carb, keto, carnivore, and eating all that fresh food. I say, no, because we've done the costing of that. So processed food, and we've actually done all this in food plans and whatever. If you're eating fresh, local, seasonal, whole food in season, it's cheaper, it's readily available. But what it is expensive in is that it's expensive in your time to prepare that.